We'll just wait a minute or two before we open up. But for people who are already on the line, can I remind you that we've got closed captioning? There is a button that you can push that will give you that. There is a recording of this session that will be sent out to everybody who registered. So you don't necessarily need to have attended, but we're very happy that we've got a large number of people who've attended what we think is a really important session. And I'm really excited to introduce two of my fabulous colleagues to all of you. One of whom is Nasser Siabi, the CEO and founder of Microlink, who will talk in a minute. And of course, Helen de Bretton, who's our client services director and knows everything on this subject. So you've got two of the best people in the world, let's face it, talking about, as we said, this really important subject. Nasser, can I start with you, please?
Hello, good afternoon, everyone, and thank you for joining us on this session on this is a disability confidence series, and we're talking about reasonable adjustment in the workplace. Microlink was established in 1992, so we have been working with disabilities and disabled people for nearly 32 years now. And our real task, really, if you want to look at it, is to find barriers that disabled people face in both in education and in the workplace, and find solutions to make sure that they can actually compete on a level playing field and they fulfill their full potential. So it's really very easy for us, because whilst we can't help to cure any conditions, we are not doctors or magicians, but we certainly know what barriers people face and what solutions exist to try to help them to overcome them. So people can actually become the really wonderful self that they often aspire to become. And that way we simply don't have to worry about any legal or any other kind of reasons why some people do not come in near the disability within their organization. So Microlink has been working with in the past 15 years, particularly in enterprise environment, large employers, both in UK and globally. And again, as I described, our work is to help employers to get the most out of their employees, particularly those with long-term health condition or disabilities. And you could imagine working in so many different countries, there are cultural barriers as well as legal definition of. So we always find ways to navigate around those sensitive conversations, how to work around people's inhibitions about disclosing or sharing of their disabilities. And again, the language is very nuanced, and our solutions are very practical. They're not really difficult or very expensive, but often are extremely impactful. So and really of the past many years, we've been very closely involved with government policymakers to try to make the schemes even more available to all the employers, especially smaller employers. Large employers have wonderful facilities and provisions where we could actually, they can afford to make adjustments. However, with the smaller companies, that doesn't often happen. But the solutions are pretty much the same. So we're not really asking them to change the world or with impossible kind of a mission. We're at a very low budget. Everything we do should be able to be done very quickly and obviously have a desired outcome. That's us, and obviously I've got a great team helping us to do this over the many years. And Helen has been with me for 24 years, from the times that we managed to support disabled students in universities all the way to managing our multinational clients across the world. Over to you, Helen.
Hi, everyone. First of all, it's great to see so many people joining the webinar. I really hope you'll get something out of it. I know we're going to have a bit more interactivity later on, aren't we, Tracy, with questions and answers and things like that. So we're going to aim to answer most of this as we go along. I've been working with Nasser for 24 years. We've supported about 300,000 people in the workplace through our workplace adjustment program. So I think what we try and bring to the table to help companies and to help people is a really practical approach to delivery of workplace adjustments, and try and cut across the challenges that organizations commonly face in this area. It's a complex area, and you know, a lot of companies are doing amazing work in this field. So and we've got some fantastic people that are joining the call, I can see, from all sorts of public and private sector organizations. Often the challenges are very, very similar between organizations around workplace adjustments. So my job is often to work doing discovery sessions, so we can do gap analysis with organizations and find out how things are going now and what the current practices are, where the areas of excellence and where the areas of challenges are. And then we kind of work around that and put in systems to support both the business and the individual. It's a balanced approach for both parties. So that's kind of what I do for the company. So back to you, Tracy. And you're on mute. That's
fabulous. I'm just typing about people not being able to log into audio. On your computer system, there is a button, if any of you are struggling with audio, that you do have to click on. But what I wanted to ask Helen and Nasser, actually Nasser, if I can start with you, why people talk about reasonable adjustments, we call them something differently in Microlink internally and with our clients. Why do we call them something different, and what do we call them?
Well, it's a good question. The reasonable adjustment really has come about because of the Equalities Act in UK. Equalities Act is 2010, which it's mandatory legal requirement for employers to make adjustment for employees with disabilities. It's a legal definition of disabilities, and that is any condition which is longer than 12 months and has significant impact on your day-to-day. There is a bit of a, how would I put it, a problem with that definition, because a lot of people who could be classified as disabled do not consider themselves as being disabled. And the barriers they're facing don't necessarily require them to go and prove that they are disabled. So, you know, if you have like neurodiversity, you don't consider yourself disabled, you just simply face certain barriers of work that could easily be removed. So why would you need to go around doing some sort of a diagnostic assessment to say you are dyslexic, for example? So the legal definition is there to safeguard the rights of disabled people, and the reasonable adjustment really is to comply with that. However, workplace adjustment is much more nuanced about what barriers you're facing. It's a social model of disability where you actually look at what people can't do and find ways for them to be able to do it. And that often means making small adjustments or giving different tools to do their work. So in an example of a person with dyslexia, they could just be helped by getting something to help them with their reading, writing, or maybe with their memory or organization. It's just another piece of software. So yeah, the more or less you look at performance, impact, and how you reduce the barriers. And that is, you don't require a kind of a proof from the employee. You take it on trust, and with a bit of a obviously expertise, you'll be able to give them a right solution very quickly at a very low cost.
Thank you for that. Helen, you did some training recently with a big law firm that we actually support. Can you give us some of the, it surprises me. We work in a bit of a disability bubble. You know, we all know what we're talking about. We know how straightforward it is. And sometimes it's nice to remember or to remind ourselves that the outside world doesn't necessarily understand how simple it is. What views did you get from doing the training?
I think, first of all, let's talk about the word reasonable, because legally, the definition, and that reasonable is a very, very, very low bar. It's often not a successful definition used in court cases. It's a really low bar that organizations have to reach. And one of the most important things to understand is it's very rare that cost will ever be used by a tribunal as a reason for an organization not providing adjustments. Because, and from Mike Tracy, you know, a tribunal will look at the entire turnover of an organization in relation to a workplace adjustment for that employee. It's very rare that cost will ever be used as a reasonable, in inverted commas, argument as to why not to put adjustments in place. I think the other thing that was a real takeaway from the sessions we did with the legal firm is the confusion around what is disability and what actually comes into that definition, you know. And there were lots of examples put up about things like the menopause. Is that included in the definition of disability? And you know, addiction, is that included in the definition of disability? So I think there is a lot of confusion out there about what is actually covered and what should be covered by workplace adjustment.
And is addiction covered? I know menopause is, but
the symptoms of addiction are covered. Addiction itself is not covered. You know, it's the symptoms of which can cause long-term medical problems that can be covered through workplace adjustments. And I think that the other area about this is understanding how low the costs actually practically are for delivery of workplace adjustments. You know, I think that there's a bit of a misconception about how high cost, you know, and how and the funding that's available and the kind of support that's available for organisations is out there.
Well, I think it's almost like black magic, isn't it? Because we know about it, we know how inexpensive it can be or cost effective it can be. And I think if you're looking up on Amazon, for example, which many of us do for stuff, I mean, I was looking up for some vitamins the other day. I don't know how much they should actually cost, but some of the things on Amazon, I went down Holland and Barrett and they were like half the price. So it's kind of important to go to people who know what they're talking about to get the adjustments that you need. But it was interesting to hear that the last case, because when it comes to disability tribunals, along with gender, there is no cap on what they can pay out, which I think does frighten some businesses to taking people on. The largest payout recently was against NatWest Bank. It's all in public domain. And I think it was 4.7 or 4.8 million pounds, which is a great deal of money. And we don't want our clients, we don't want any of you listening in now to be in a situation where you're having to go to a tribunal. We know with a lot of public sector, obviously they have a legal obligation, they have to go to court. But at the moment, there's nearly 11,000 tribunals that are currently going through the system on disability discrimination, which is a lot. So Nasser, can you give me an idea? Helen's mentioned about costs. What kind of costs are we looking at?
Well, actually, depends. If you're looking at a well-established, operated workplace adjustment, the average cost is well below £1,000. I mean, we know this from our massive data set of going over 15 years. And access to work, which is often used by most organizations for making reasonable, it is reasonable adjustment that they use. The average cost is quite substantially higher. So if you do it correctly, and again, not to worry about the proof somebody needs an adjustment because they have to prove they are disabled, then the kind of tools you'd be using for them could actually benefit a lot more than that person with that condition. So someone with reading and writing difficulty could have it as a result of stroke, dyslexia, or maybe an accident. So the same tools could apply. So it really, this is why we always mention this. We don't deal with a condition because conditions can be very complex and can be quite beyond our knowledge. However, impact and the barriers are within our remit and our expertise, and we know how to overcome those. So the same tools could be applied to multiple conditions and have the same outcome, which is the individual is able to do their job and do it effectively. So in terms of average costs, depends on how the organizations really look at this. Some organizations purely focus on, let's say, neurodiversity because they think that's more important. Some people look at pan disability. Some people look at also maybe musculoskeletal. If you look at it as a holistic end-to-end with everything included, including training and equipment and assessment and complete coordination to the end, it shouldn't be more than £700–800. That's the data we've got. But if you were to do it ad hoc, I know that costs can run anything up to £10,000–20,000 easily. Because really, by the time you end up helping someone, it's so late, it's become so complicated, it's so complex, and then you're not just dealing issues with the impact of the disability, then you have to also bring in legal people in, you've got the HR manager running around trying to, fix things. So the hidden cost is often not considered when they're talking about adjustments. So it's a difficult one to answer. It's how long is a piece of string? But I would say doing it, the cost of not doing it is much higher than doing it, and doing it properly is much cheaper than actually doing it ad hoc. That's the best answer I can give you.
So what we're really looking at is a very structured process and the recommendation of having an end-to-end something, internal or external.
For SME, it's much easier. There is so many, for a large organization, there's so many layers by which people need to have an adjustment. So you have the occupational health, you have the HR, you have the legal, you have the D&I. All these people have to get involved in order to get one person who needs support all the way to getting a support. And you also get external agencies and supply chain involved, and you got the IT department, you got the facilities. So difficult to coordinate unless there is a team doing it. For a SME, it's straight from purchasing, IT, get the job done. But obviously the problem with the SMEs is that they don't have the subject matter expertise to recognize if somebody has a disability and what to do about it. I think it's very much like how the organization treats this. If it's just systematically, then you put people in charge of coordination. You will select a very well-defined catalogs of things you're allowed to use and not allowed to use, and then the IT department don't need to put block on things being installed, and facilities know what they need to do when somebody needs a desk. These are all the things that you need to do, and once you do it, it runs like a dream, and it runs very efficiently and very low cost. The return on investment is multiple. I would say 5 to 10 times what you spend.
Wow. So can you give me an idea? We mentioned the 3 critical success factors for doing this. Can you give me one, Helen? And then Nasser, if you can give me another.
Sorry, before going to that, we have
Sure.
a question here.
Thank you.
Law Firm Disability Network coach here. Interested to hear any advice you have on assistive tech for those of us who work with companies that have stringent information security requirements.
Do you know what?
Which can mean that, go on.
That is exactly what I was about to go to as one of the critical success factors. This is a really common issue, right? And it's not just for law firms. We work with banks, we work with NHS trusts and defense. Yep, we've even put adjustments in a submarine before. But the type of the security of software is really important. What this starts and ends with is the business having an approved catalogue of software and products which it can support. And that is a real critical success factor. But that will only work if the assessment is taking that catalogue into account. And that is where we're going to talk about access to work a bit later, but that is where some of the challenges within organizations can lie in the implementation of adjustments, because the assessment isn't always linked with the business's infrastructure and the business requirements. Nasser, did you want to say something there?
Actually, there is also the added complexity of software now becoming more cloud-based rather than on-prem. And it mixed the two together, and unfortunately, it's a bit of a disaster when it comes to IT departments, because their job is to keep the state completely safe and no vulnerabilities. And if you have data sitting in a server in America, that's an immediate breach for some of the clients.
Yeah.
And I know law firms are particularly sensitive to that. So often the biggest reason why adjustments don't take place is because the IT department, quite rightly, say we can't have that particular software installed. And if that software has been recommended, if you don't do it, then you're at risk of what we might consider not complying with the reasonable adjustment directives or the legal requirement. So yeah, there is a solution, always is a solution. There are products that do the same thing, but you may not be aware of them. That's where I'm glad to say we've got the vast expertise of knowing what products exist, what new products are coming out, what they do, and also guiding a lot of vendors to actually make sure the softwares do not get into this situation. So we are working actively with lots of vendors to make sure what they produce is fit for purpose when it comes to corporate governance.
Yeah, we've got a question actually building on that one, please, Nasser. Do you think, from an anonymous person, but it says, do you think that it's in the future AI could help detect that a user isn't using tech as expected and almost make suggestions or referrals more proactively?
The AI itself is a problem for IT security.
Yeah.
So once we overcome that, then they might do wonderful things. In fact, if you know much about the Microsoft, they've got the Copilot, and that is supposed to help make life easy for everyone, including those who are disabled. But there is an element of reaching the safety level for the companies to say, yeah, actually it's safe to use Microsoft or Google products because they run on your own tenancy. So the data never leaves your premises, your state, but that still doesn't answer a lot of the AI and the ethical questions. So it's too early to say, but certainly AI promises to revolutionize and transform the way we work and we live. It's going to be one element of who's making sure they are the right kind of solutions and they are actually not crossing the ethical boundaries. Early days, and there are lots of clever people are thinking about that right now. So I'm the last person who could say I'm the expert. But we do know a lot of the products coming out use elements of AI. Maybe it's a bit hyped up. There is, people are still rebranding the product, thinking by calling it AI is going to make it even that flashy. But I think there are real serious areas of data and bias that's built into AI that could potentially have a negative impact on people's lives. I don't think it's we know enough about it to actually raise alarm bells. But
one of the things that you've spoken before about Nasser is where you have perhaps a global or a group license. I'm not very IT orientated, so apologies. Is it an enterprise license where your IT can actually see who's using what at the time? So whether or not there's a training need, for example.
Well, it's absolutely. In fact, one of the biggest reasons or barriers for making reasonable adjustment often comes down to cost, even though, as Helen said, law doesn't consider cost as a reason for you not to make it. So, and there is a huge amount of waste that goes on even today, where people get recommended things that they never use. It happens in across all sectors and in all areas, and you could prevent that by having a very bespoke agreement with the vendors that you use their products regularly. Dragon is often mentioned. So
it isn't just one of the questions here, Nasser. Somebody's got it. It's been recommended, but the minimum configuration system requirements can't be used.
Right. Well, that is an issue for the IT department to understand. They have to make that adjustment, give you a different computer. But if the Dragon suddenly, the one they recommended, let's say is Dragon Anywhere, and that is like using a cloud solution rather than the on-prem, you will have problems. We'll have problems with many organizations unless it's gone through your security governance approval. The obvious point here is that if you've got a software and you know it works and you know it helps the employees, then you can carry on using it for as long as your operating system actually is not upgraded or nothing has changed, and only move on to the new version when you're ready. You can only do that if you've got that agreement with the vendors operating on a global licensing agreement. So that's one way of not only preventing waste, because if you've got 100 users of Dragon and you only got 50 users of Dragon, you don't need to buy another 50 licenses until you reach that level. So and they have oversight of who is using it. And if they're not using it, you can do two things: offer them training, or so if you don't use it, then we'll reclaim that license and we'll recycle it or redeploy it for someone else. These are what large organizations are doing. Without it, you have no visibility which versions they're using, who is using what, and if there is a new update, you will not be able to approve the use for a long time until it goes through your
I think as well, Nasser, I think one of the things that is important to bear in mind, and I can see on the kind of questions coming through, If a company gets an approved catalogue of assistive software, there are only a few packages that you actually need to cover your organization's requirements, right? We're not talking about 100 different packages. We're talking about less than 10, really, that you can have in your organization that will suit every kind of disability or need. Okay, so those bits of software, we can work with an organization to make sure they are approved, they are secure, and they do meet those parameters within the organization. So you kind of remove the problem where things don't work on certain spec laptops, or things don't get through the security, because it's already there. It's established with the IT department that if somebody has, this is the alternative for that, which will work for them with this training. So I think that's important to understand. It's not a massive, huge list of software that companies need to get right.
And it's very also important. Training that you mentioned is absolutely paramount to success. If you're giving people software and they're not trained, they're not going to use it. So it's a wasted opportunity and wasted resource. And the other issue is about, as Helen you rightly mentioned, there are a finite number of products that you need to deal with most of the conditions. And those, and in particular, when it comes to security aspect, I know most of the people here would have come across Grammarly. It's a great software. It's used by university students all the time. Come to the workplace, almost every client we have says we can't use Grammarly, quite rightly, because one, their contracts won't allow them, and two, the legal people will say, no, we're not happy with this particular setup. And the best thing about it is we know there are solutions other than Grammarly, and hence we allow our clients to try them. We help them to obviously evaluate it, and if it works, then we make sure that they get the licensing in accordance to their needs. And sometimes they realize that this problem has been backlogged for several months. In one go, they can fix several cases in a very short time.
One of the things that's being asked on here, there's two questions actually. One from Nikki Parry to say, is there an alternative to CaptionEd? And then the second one, is there an alternative to motion software? And then the third question, Helen, I would like you to think about is the training. So Nasser, if you could answer the software one. Helen, around the training, people are saying if it's too abstract and it's e-learning only. So if you can think about that for a minute, if Nasser can answer about the software.
So there is an alternative CaptionEd. You've got to always kind of mention what is it you're trying to do. And we often say, well, this is the right tool for it. And CaptionEd is basically a captioning software. And I have really had a great relationship with the organization, with the vendor, and I've also advised them why people, enterprises will not approve them. Some will, but some won't. Partly because the element of cloud and the server is outside the estate of those clients. And depending on the different type of sectors as well, it might be impossible to get it approved. There are products out there, even within the, for example, Teams, they've got their own captioning, and there are third-party apps within the Teams that can actually do the captioning and translation, because everything sits within the tenancy of the enterprise. Data is safe. Data is not leaving the state, so they can actually have it approved. There are solutions, but we need to understand the context, and then we can recommend what actually might do that for you.
That's wonderful. And what about the motion?
Motion software.
Yeah, I again will have to talk to our assistive technology colleague experts. We've got about several here. The job is to research and development and find new products, and we can refer that to them and come back to you on it. Yes, absolutely.
So Kelly, if you want to reach out, Kelly Roberts, if you want to reach out, I'll put you in touch with our IT guys. Thank you, Nasser. So Helen, training.
Yeah. The thing about training is that it's got to come at this from a kind of multifaceted way. Training is so important to take into account the job role, the conditional disability, like the impact of the conditional disability, and the assistive software. So we would always recommend actually one-on-one training is an absolutely important critical part of any training with assistive software. I think e-learning and refresher e-learning can be really useful as a as a top up or a reminder. So if you once you've had that training, if you haven't used a certain feature for a while, you know, you've got something to refer to refresh your memory. But the initial way of using assistive software is a combination of that job role, the impact of that specific condition, and the assistive software itself. And an experienced trainer should be taking all three into account and really providing a bespoke one-on-one solution for each individual that they train with. And that's really important.
E-learning has a place, and because we're such a we have a busy lifestyle, and there is very tiny capacity left for learning new things. So blended learning is always the best way to go forward. You know, you don't want to burden people with too many sessions of one-to-ones, face-to-face. It just people won't have the time or appetite for it. In fact, one of the other areas that we know that a lot of our clients often mention and maybe complain is that too many sessions are recommended by access to work assessments. And access to work assessors don't necessarily say you need to have it, say here it is, it's available if you need to take it. And obviously if a person's expectation is, in order for me to do my job, I need to take all the 16 sessions, that puts a burden on the employer to allow them 16 sessions to do, which is not practical and is not needed. So yeah, but definitely e-learning with one-to-one, face-to-face, or some not face-to-face, maybe in-person training could actually be much more beneficial, and they go away and practice and come back for another session. It is absolutely critical that they should have the training. We've got tons of research showing nearly 60-70% of assistive technologies goes to waste because people don't know how to use it, both in the higher education and in the workplace. It's a waste and a lost opportunity to make sure a person is actually doing their job better and they have a fulfilled kind of employment. If they don't, they just give up on any other solution. They think nothing else is going to work.
Okay, can I just, somebody, Yvonne has asked to repeat the 3 considerations for training. Helen, you mentioned.
Sorry, yeah, if I went too quickly for anyone. So it's the impact of the condition or disability, so where the actual challenges are that the individual is facing, the job role, so what is required from them, and then obviously the functionality of the assistive software. So those 3 things come together to give a really individualized approach to training.
And the training has to be multifaceted. It's learning how to use the tool is important, but learning how to apply the tool is even more
to your job.
So hence we're looking at not just assistive technology training, but coupled with coping strategies. I have this tool, I have this problem, how do I become more efficient in my doing? So again, that is down to the trainer's skill, and the trainer foremost has to be a teacher, and then technologies, not the other way around, because then we'll understand what will make that individual become more effective in doing their job. And incidentally, you know, there is a lot of talk about mental health and how you support people with mental health challenges. If you really dig deeper into the cause of mental health, a lot of it is to do with the stress, anxieties at work, or not being able to do their job well, and then they become under pressure and performance management. If you are able to do your job better, more effectively, then you find that a lot of the reasons for that escalating to become a long-term condition disappears. And equally, if you have those challenges, you want to come back to work, job can be a very good therapy. If you're doing your work well, that's a very positive impact on your mental health. And again, coming back to coping strategies, you know, if you are affected by mental health challenges, you have a similar symptoms to somebody who's got, let's say, dyslexia or ADHD, or because your brain functions are actually impaired. You can use the same technologies to help them to cope better at work. It's a wonderful kind of a solution to a lot of the problems that we come across these days.
I find it quite interesting because a lot of the symptoms that Nasser was talking about there, I get as somebody who's perimenopausal. I get brain fog all the time. I find it difficult to concentrate and remember stuff.
And
so it's not just And long COVID has the same symptoms, including hearing. We've got a couple of questions here that I'm conscious of. We're talking about with the employment tribunals. We talked about NatWest Bank, and somebody who said if you've got a big company who have the full access to a suite of software and a range of physical adjustments, where do these companies most frequently go wrong and end up with claims? So if you've got all of the things that are available there to the employee, what's gone wrong? Helen, could you answer that, or Nasser?
Nasser, you go first. You were taking a breath.
Well, I was going to say, just having the tools is not the solution. You have to have the processes by which people can comfortably come and ask for help. And it shouldn't be hidden in some little silos and in very dark corners that people can't find. And that is actually quite important. The second is the culture, the line manager awareness.
Training.
That people, absolutely. So you really, having the tools is just only one part of the solution. The other part is organizations' view and attitude towards adjustment. If you want it as a productivity way, as a way to get better cohesion, better engagement, then you're far more likely to get it right than if you were trying to sort of fix a problem because the law expects you to. And that's where I say that we are not, nobody's experts in this area apart from a judge. So if you try to work on the compliance route, even though you've got the software, you may just give them the wrong solution because you don't want to spend money on getting an expert telling you what you need. And equally, if you've got an IT department who is not engaged with this process and say, no matter what, we're not going to allow you to put anything outside of what we feel is safe, then I'm afraid you're going to get into that kind of a trouble again, because there are other companies who are doing it. They seem to be fine. Why is it you're not? So you've got to have that level of engagement at a high level from all the stakeholders, whether it's HR, facilities, IT, and DNIs, and especially line managers. That's how you get the success.
Yeah.
If you do it in,
I also think, I mean, often people can get to the assessment stage easily enough, whether they go through Occ Health, which I know, Tracy, is something that you talk to a lot of organisations on, or whether it's access to work. You end up with an assessment, but the implementation and training of the kit is often where companies really struggle, you know, and a lot of that comes back to ownership and somebody having a handle on that employee's case right the way through their journey, getting workplace adjustment. So from the moment at which that referral comes in to getting the assessment recommendation to getting them implemented, you know, if it's left to kind of line managers to navigate or employees to navigate themselves without any kind of where to go in the organization, that can be a really common area that organizations fall down in.
We have case studies going back many years ago that organizations reduce the legal costs and tribunals by 90% by doing a workplace adjustment program. And one of the very largest banks in the country actually demonstrated that the employee engagement gap between disabled and non-disabled dropped down to 2 points. It used to be about 15, 20 points, I'm not sure. So these are actual real results of being able to do it systematically rather than ad hocly. And that's the secret. You have to, and by the way, I'm not implying that this is going to cost you a lot more. Doing this systematically actually ends up driving the cost down and the timelines significantly lower than if you were to do it in a one-off. And what most companies tend to rely on access to work to do. It really just doesn't seem to join up together.
There's two things that I wanted to ask you guys, if I may. Access to work is one, and Helen, if I can come to you on another one, which is we've got a colleague here who's joined a large one of the big four. He's visually impaired. What kind of adjustments are going to be made for him? Chap called Basra.
Oh, there are. I mean, assistive software is often the cornerstone of adjustments for people with vision loss. Making sure that their software, so it depends on the extent of the vision loss. So if you're working with a piece of software called JAWS, which is a piece of software which enables keyboard control of a computer, it's important to make sure that the applications that the company use are able to support that. And often there's a little bit of work called scripting or coding, which sits in between the two to make things function as they should for the individual. This comes a little bit back to accessibility, good accessibility. There's two types of accessibility in my experience. One of them is tick box, you know, the WCAG standards, the stuff that we should all be doing to make sure people can read fonts. But the other one is practical accessibility, which is it takes a blind user 47 presses to actually get to the same field that a sighted person would with one click of the mouse. And I think that there's a little bit of disparity between the two things in organizations. Training and assistive software would be the cornerstone, but also potentially some upskilling of the line manager in how to communicate effectively, how to manage work tasks and that kind of thing.
That's a really interesting answer. Thanks for that.
And really one thing else, the message is not, these are not very costly changes, adjustment. A lot of the products recently from Microsoft and Google have built in a lot of the accessibility tools into them. So for most users, like somebody with visual impairment who needs a maybe larger screen, you can use Microsoft without, or in fact, you could even use it for people with literacy problem, reading and writing. You know, you got immersive reader within Microsoft Word. You've got you got the Word dictate. These are the things
Help
we
a
use
bird.
to pay.
Yeah.
Well, Help a Bird is like more of a Google and others, but okay, what you do have, tools that people can just use and get by, don't need any more extra help. Things that used to cost a lot of money, but knowing that is important. And one of the success factors of getting it right is actually having an expert team internally who understand disability and understand what's available to help those people who are struggling. And there are lots of other factors, including funding it. You do not want your line managers to decide on the future of your employees because they are quite budget conscious. You want to make sure that if somebody needs the adjustment, it's funded from some central source. It doesn't have to be a pot of money. It needs to be that it's fine, go ahead and do it, and we'll pay for it. And then worry about who pays for it internally. So these are, and then the other important, which we highlighted before, is line managers should not be doing coordination. They have an important job looking after a team. The last thing you want them to do is run around trying to knock on doors, say, can you install this for me? Can you actually make sure that desk has been replaced with this one? It's something that it should be done by a coordinating team, whether it's internal or external. And once you put these various sort of requirements in place, then you find that it's not only it's sustainable, it's highly effective, and it doesn't cost money. One of the things we discovered recently, we've been doing a lot of discovery sessions with some of the public sector and some private sector. We discovered that most of them have no visibility how much money they're spending on disability today, even though they thought we haven't got budget. So much going on without them realizing. Once they put it into one little central pot or virtual pot, they realize, my God, that's an awful lot of money. We're getting very little results. Hence, the idea of going back and making sure that the funding is not an issue.
It's interesting, actually, we've been talking about adjustments, and Jim Rush has just sent a note through on the Q&A to say, don't forget about the physical adjustments you may need to do. So barriers into getting into work, staying in work, navigating the corridors, everything to do with the built environment, really, really important too. And again, perhaps we go back to training and talk about training the group that individual, such as Basra, will be moving into, so that group knows. How do you attract a blind person when they're not looking at you? Because you can't sit there and wave. So how do you attract their attention? How might you guide them around a building? The real basic stuff.
Well, if I may just say, organizations, and Jim actually is one of those people who are doing it absolutely right. Look at the holistic picture. They're not just looking at one individual having adjustment. They look at the environment, they look at the work, and they look at the kind of how do I put it? It's person-centric, but they have to make the environment also right. So if a blind person gets to their desk, they can do their work using using the assistive technology. But getting to the desk is sometimes a struggle as well. So yeah, it's holistic design is obviously the answer. And people
It's
like
tough, isn't it, though, where
yeah.
companies are like renting spaces and in so
Yeah.
many sort of varied
Absolutely.
environments.
Absolutely.
But yeah,
It's a challenge. So it's not just, it's like a wheelchair user. They can do their job if they're behind the desk, but can they climb several steps to get there? That the answer is you've got to make sure you look at the complete journey from home to work and back home. And that's what good organizations are doing. They're looking at the complete environment design. It's not an easy or a quick, but they are doing it because they know it's for the right reason. And attracting the right talent is a very good word to use. It's not about, well, we have disabled people, we have to do something with them. No, you actually want people who are disabled to come to your organization by choice. One of the greatest CEOs was very engaged with this disability. He said, well, I must say, I didn't think my organization is good enough for my disabled children to join.
Yeah.
Because that's why I'm working towards making it. It is the best company to work in, because I know my children are very talented and I could do with them, but they will never join me because they don't think I'm inclusive enough. That's a big statement from a CEO who is doing so much for disability.
Huge, isn't it? Huge.
I think it's the right person for the job, irrelevant of disability, isn't it? I mean, it should be.
Yeah. Absolutely. And
but it is building in. We don't see enough, I don't think, companies taking into account accessibility in their recruitment practices on their websites, their PDFs, which might be closed. Lots and lots of barriers.
Well, I'm not the one to talk about myself much because I don't need to, but I've got nearly 50% of my workforce are disabled, and they proudly say they have disabilities. And I think we have the best team in the world to do what we do, and I can prove that as well. Partly because they have this skill I need, they have the drive, the passion, and all the energy. All they need is a bit of adjustment. So it's the disabled people are the answer to all those problems that organizations have not been able to fix for many, many years. They've tried every other route, hasn't worked. That's why you get lots of employers now trying to attract neurodivergent talent, like autistic people. I know the security forces are actually looking at cybersecurity, autistic people, and there are also other areas, whether it comes to accessibility. We've got a fantastic team doing remediation for inaccessible documents, neurodivergent. Honestly, the output is 3 to 4 times higher than a typical person. So you have talent, they're looking for a job, make yourself attractive so they can come to you.
Yeah, absolutely. Absolutely. But you've got to put the work in. This is the thing. All we're talking about here is very, very straightforward, structured ways of making your current workforce really healthy and happy and shining. What we talk about in terms of recruitment, which is the area I specialize in, is something, again, along with workplace adjustments, that you really need to put a lot of effort into up front. We can help you. As Helen mentioned, we do a lot of gap analysis work. Helen leads on, but it is important to look at all the different points of a journey that a colleague might take. And Helen, can you give me any examples recently that you've come across where things haven't been done, and then we've come along and you've gone in and said, well, this is how we can change it for you?
Yeah.
She says, love that.
Like we were saying earlier, they quite often kind of come back to the compatibility of recommendations and finding alternatives for people that work, finding alternatives for the organizations that work. Some of it is interesting when we conduct stakeholder workshops, because workplace adjustments, they touch upon so many areas of a business. So health and safety, facilities, IT, HR, EDI, ER, and having these stakeholder workshops and bringing everybody together. And often it's the first time that all of these people have met each other within the organization. And then you can start to really break down barriers within businesses, because the people coming together, it's the first time they've heard, well, that's why IT can't make that kind of particular thing, or that's the problem with facilities. Oh, right, you do need to think about power supplies when you recommend an electric height adjustable desk. And I think I've really learned recently that the value of bringing together these stakeholders is within organizations, and I think that is a real path to making massive improvements.
That,
I would agree. I mean, Amy White's just asked a question on the chat saying about 70% of disability is non-visible. And do you guys have any advice about how to educate managers and the workforce around the barriers faced by people in terms of achieving general understanding?
Well,
so like disability awareness, I'm guessing there.
It's a good question. If you want people to share why they need to know why you want to know. So it's just saying, well, our disclosure rate is very low, so we can't do anything about it. Well, if an employee feels you're not going to help them, they won't tell you because they think you might just use that as a reason to get rid of them. So that's one reason why disclosures can be very low. And the second way a disclosure or the sharing would be low is you've given them everything they need. So they don't need to tell you. So the key to getting this right is make certain things available to everyone. You know, the cost of software is now so affordable, so low cost in a way not to worry about. As I said, technology is built in with Microsoft, able to give you a lot of the tools for free, but they are often deactivated for no reason. That feature is not available. If you make those available and people are guided towards using them, then you discover two things. One, actually helps everyone, not just people who need them for disability. And the second thing is a lot of the reasonable adjustment or requirements would actually go away. Somebody who does struggle with writing, spelling, they can use Microsoft Dictate if they have a quiet environment to do it and a good microphone, or they soon to have Copilot. They can actually do spell checking and grammar checking for you. But as I said, the solutions are not expensive. But once you make it available, so it's just allowing a kind of a ramp access to a building, both the mothers with prams can go as well as wheelchair users. You're not actually telling a person, this door is for wheelchair users, only for disabled people. You're actually making the door wide enough for everyone to use, including wheelchair users. That's how you can change the culture. People will come to you if they need help and they know you're going to give it to them. That's how I think you could actually raise the awareness. And if the line managers know what's possible, it's very important. HR needs to tell them what they can or can't do in terms of making soft adjustments. Then you'll find that the confidence in line managers will increase because they know they can actually go to an expert, say, I've got this person, it's got this requirement, what's the solution? And if that process of getting the solution to them is very quick, whether it's internal or external, then you'll find the line managers would be the best friends and advocates for the disabled employees. And we've got case study to demonstrate before doing this systematic implementation, nearly half the line managers said, sorry, it's not for me, I don't want it, and I don't even want a disabled employee because it causes problem for the rest of my team. Yet, after the implementation, everything is working, 95% of line managers actually said, not only they supported, they also promoted to other organizations.
Thank you ever so much for that, Nasser. I'm very conscious we've got 7 minutes left. We are getting questions coming in thick and fast. I wanted to see if we could get through a few. We've got one from Thomas King saying, reposting for everyone, if a company decides to reject a reasonable adjustment request in whole or in part and give a rationale, do they have to provide evidence to support their rationale? Or is it okay for them to say, we feel like this would affect the quality without providing specifics, or why this is proven and valid concern?
Sorry, before going to that one, someone raised hand. Do you want me to allow?
Oh, I didn't say yes, please.
The person to talk, maybe allowed to talk?
That would be lovely, please. Melanie, you're on mute at the moment. Did you have a question or comment? Melanie?
I think she's having difficulty with the microphone.
We can't hear you, but we are here.
Yeah. Should I answer that one while we wait
Please,
for Melanie?
if you can, that would be wonderful.
So it's a very good question, and it's also, the answer is what's reasonable is decided by a judge. However, the steps you take before you get to that situation is very, very important. So if you have a situation where you go and say, we can't do this one, they will need evidence. What have you tried? What was, and if you go to an expert and the expert says, well, we've tried everything and it's just not doable, then you will obviously, you have a good solid reason to go to a tribunal or to any other appeal case, say, well, we've done this and the person still can't do the job that is paid to do. Then within your rights as an employer, you could say, well, we might have to consider a different role, but not this one because the adjustment doesn't seem to work. But if you don't have those in place and say, we just don't feel it's going to be good, then I'm afraid you might end up at the wrong side of the judge's ruling.
It's always, you need to show the due process. You need to show you've done everything. Really, really important.
And if you're using experts to tell you, then you're not being challenged. It's the experts who will be challenged. So if somebody says, this solution cost £100,000 because my IT told me, if your expert says, well, that's actually over the top, it shouldn't be that much, maybe £100,000, 90,000 is because of internal costs rather than the solution, then that's your answer. Because I know one public sector was awarded quite a lot of money because they said that solution for that blind employee would cost £100,000. It doesn't cost £100,000. They just simply added their own cost to it, which is not considered as reasonable.
I think that's a fair point. I mean, Emma Wood makes a comment on there about hating asking about adjustments because you're aware of the cost. And I think that's true of all people with disabilities, myself included. We're always very conscious we don't want to be a burden on our employer in case they suddenly decide they don't want to employ us anymore.
It's a bad word, isn't it, burden?
Well, it is. It feels that burdenness. And it's always nice to talk about it openly.
And disabled people are no different. They just don't want to attract attention to themselves. You know, they don't want extra support, help for the sake of it. They just think in order to do their job well, they want to actually,
they're just tools, Nasser, aren't they? They're just tools to enable people to do the job. No different to a laptop, no different to anything else that's provided to any employee.
Exactly.
Absolutely right. It's the right tool for the job.
Okay, we've got 3 minutes. I don't know whether we actually got the answer from Melanie. I know she had some technical difficulties going on.
I can see a question posted by deputies with the NHS organisation. And actually, we're running discovery sessions for NHS trusts as we speak. And that is probably a great option for the NHS.
Helen, could you give a brief rundown of what that is? Is this something that we're going to open up to more people, like the people on this call, for example?
Yeah, I mean, a discovery session is really us getting the right people in a room together. Again, this is the people that have often never met, and us really teasing out what's going on currently, where the gaps are, us filling in some of the kind of financials and the data from our experience, and producing a report with clear recommendations for a pathway to improvement for businesses. And those discovery sessions are they're really brilliant for the NHS Trust.
And we offered this recently to several organizations, public sector in particular, who are really trying to do this but weren't sure where to start. So we did a pro bono review of the services, what they were doing, how they were doing it. Hopefully give them a very quick guide on how to fix or join the dots. Not fix the problem. There are often disconnect between various parts of the process, and they always come back with a solution. And that solution should not cost them any more than what they're currently spending. In fact, if they do it, they might be saving a lot more. So yes, if you are one of those organizations, do reach out, and we certainly have a program running at the moment with several.
Thank you, Nasser. We're just about to run out of time. I'm conscious that there are unanswered questions. We will be taking a note of them and coming back to you. If people want to contact us directly, please feel free to do. It will come along with the recording, either myself, Nasser or Helen We can talk about discoveries, we can talk about software, we can talk about how you encourage your own CEOs to get on board with the program and support the staff. So, you know, we're not the only people who do this. There are other companies out there. I like to think that we
and your
are fab.
recruitment.
Oh, well, yeah, if you want to
your
talk about
talent.
recruitment audits, by all means, get in touch. I love going through people's recruitment processes. But I wanted to thank you very much for your time, Helen, today, and of course, Nasser.
No, it's great interactivity.
Thank you for joining.
Thank you.
And please, we will come back if there's questions, as there are with Access to Work. We can help. There's a lot of information we've got. Please come and talk to us. But thank you ever so much. It's been wonderful fun.
Apologies for technical hiccups with the audio. Some people.
Yeah, it always happens, doesn't it?
All right.
Best laid plans.
Okay.
Cheerio,
Thanks,
though.
everyone.
Thanks so much. Bye-bye.
Bye-bye.
Bye-bye. Bye-bye.